It is commonly acknowledged by professionals in the field of suicide research that statistics underestimate the true number and therefore the rate of suicide. One of the main reasons for the underreporting of deaths by suicide is the misclassification of deaths. This means that the cause of death is coded as something other than suicide. It could also be difficult to determine whether there was intent to die in situations of self-harm leading to suicide. Childlines state young people's suicidal feelings often increased alongside a developing situation, such as the gradual breakdown of a relationship, loneliness, or abuse. As situations worsened, they described how they found it increasingly difficult to cope. Many young people said they hadn't acted on their suicidal thoughts because they didn't know how to end their own lives, were too scared to do it, or the thought of how it would impact their loved ones was stopping them. Some saw their fear of ending their own life as a weakness that they should punish themselves for. They spoke about cutting themselves, food deprivation, and purging. However, many felt that suicide was the only feasible solution to ending how they felt or resolving that problem. Young people told Childline that they self-harmed instead of talking about their feelings, or as a way to cope and distract themselves from their suicidal thoughts. For those who had been self-harming for many years and were too used to the pain, suicide had started to seem like the only way to escape from the hopelessness and desperation they felt. This film will highlight top tips for supporting young people around suicidal ideation in conjunction with the Sheffield Suicide Prevention Strategy. My experiences with mental health started when I was about 11, which was mainly with self-harm, but I've had a lot of experiences of being in hospital, whether that's as an inpatient on a psych ward or at the Northern General. I've been through counsellors, I've tried different medications, I've been on section, I've struggled a lot, and it meant that I didn't get many GCSEs, I didn't leave school at the right time, and has just altered my friendships and just my general daily life, and I still struggle now with my emotions, and I'm still on medication. Finally found something that works, but really finding it difficult, and it's not been a fun journey. 34,517 counselling sessions were held by Childline in 2013, with children who talked about suicidal thoughts, a 117% increase since 2010. It was relatively easy to access CAMS because that was a letter sent to my parents who were quite willing for me to go, and they just took me to my appointments. But to access AMS, which is the adult mental health team, is really hard because you have to go through your GP to get a referral, and if your GP doesn't know anything about it, it can take months, or they might not even send the referral letter. They might say, oh well, it's just a bit of depression, have a tablet. I think mental health professionals and all professionals can help prevent suicide by listening to people and hearing what they're saying, not just going, okay, this is a tick box, this is how you are, this is how we're going to treat you.
Nearly 6,000 of these children had told a counsellor that they had previously attempted suicide, a 43% increase on the year before. The vast majority of these children had not revealed their feelings to anyone else. I'm a suicide survivor myself. I've also played a supportive role in helping my friend through crisis. My experiences with mental health services, personally and both supporting someone else, has been fairly negative. I didn't get any support that I needed for my own mental health. It took a second suicide attempt before I was even referred to my community mental health team, and even then I was put in the crisis house, which was amazing. It was the best decision that could ever have happened to me, but after that I was just discharged within 3 days, and at that point I was still in crisis. 60% of people who are suicidal don't receive treatment. So my experiences with mental health services in a supportive role have been widely negative. I've been in some really horrible situations. I think probably the worst moment that I had to deal with was when I was stood in the resource unit at Northern General, and Robin had taken an overdose and was being aggressive, and all of a sudden her heart stopped, and I was stood at the foot of her bed, and there were people running around her and people shouting medical terms, and I could hear the heart monitor, and they were doing chest compressions. I was just stood at the foot of the bed staring at my best friend with without a heartbeat. Luckily they got her heart beating again, and they put all these horrible tubes down her throat and had these pads that they were going to use to shock her heart, and it was horrible. And 4 hours after that they released her because the crisis team decided that she was fine. They said Robin needs to take responsibility for her own mental health, but she just needed help, and she's been trying her whole life to get that, but she's just never been given it. She's never been believed. And the cycle just can repeat, and I know it's not just in our situation, it's with other people, lives just being a cycle of suicide attempt, being released, suicide attempt, being released, and never being believed by anyone.
Somebody dies by taking their own life every 40 seconds, according to a significant report by the World Health Organization. It's mega important to me to raise the awareness of mental health in young people, because there's so many of us suffer, and a lot of us won't talk about it, won't admit it, or we'll sit there and think we're the only ones that suffer, or yeah, we've got friends that suffer but we're not as bad as them, or we don't need help, or they can't help us, and we end up being our own worst enemy. So it's super important to raise that awareness and make sure that everyone knows that it's okay to have it, it's okay not to be okay, and that you're not on your own, that loads of people share similar experiences and can go through it with you and can help you to find some way of managing it. Maybe not making it 100% better, but just making it bearable.
What I would recommend to any other young person in a similar supportive role to another person who's in crisis is look after yourself first and foremost. You've got to get your own coping mechanisms in place. You need to build up your own resilience before you can help anyone else. You can't help anyone else until you help yourself. You can't dig yourself into a hole because you end up just dragging your friend into it with you. Get an attitude where, you know, if you don't laugh, you cry. That's the sort of attitude that I got. And most importantly, know your limits. And if you've reached your limit, try your best to get your friend the support. Peer support is a really, really wonderful thing, and it can play a massive part in improving people's mental health. And I do honestly think that there should be more peer support programs across the country. Here are some top tips for suicide prevention. Make assessment of risk. Take suicide gestures seriously. Be yourself, listen, be non-judgmental, patient, and think about what you say. Check associated problems such as bullying, substance use, bereavement, relationship issues, abuse, and sexuality issues. Check how and when parents will be contacted. Encourage social connections to friends, family, and trusted adults. Ensure support or contact with young person is in place. Seek a risk assessment from a GP and check the school nurse's opinion. Make appropriate referrals. Set up a meeting to plan the care pathway interventions based upon understanding of risks and difficulties. Provide opportunities for support. Strengthen existing support systems. Consider protective factors. Make sure you record your assessment, concerns and actions in line with your agency's procedures. Do not promise absolute confidentiality. Do not make assumptions or react without considering all the risks. Do not dismiss what the child or young person is saying. Do not presume that a young person who has threatened to harm themselves in the past will not carry it out in the future. Do not disempower the child or young person. Do not ignore or dismiss people who self-harm. Do not view self-harm or suicidal thoughts as attention-seeking. Do not assume self-harm or suicidal thoughts is used to manipulate the system or individuals. Do not trust appearances.